Hello everyone, happy afternoon, a very good afternoon. Am I audible and visible, everyone? All right, so happy afternoon, everyone. I hope and I believe all of you are doing well and you are in your good gears for preparation for your upcoming FMG exam, which is in the next 3 days. And I hope you're not letting your stress and anxiety overpower you. You are right in your hypomania state and not a depressed state or a mania state which affects your productivity, right? So you have that high and you have that productivity also maintained till the last minute. Very, very important, right? So here we are into our next session, the FMG Sureshot Final Punch 2. We have 4 sessions. First one we did yesterday. It's available on the same YouTube channel. If you have not watched it, if you have missed it, please watch it before your exam. Definitely there are going to be questions from there. And today we have the Final Punch session 2. Thank you so much, Lopa and Acha. So Vishal, I can totally understand through everybody saying that समझ नहीं आ रहा कि last के 3-4 दिनों में क्या पढ़े. Right, if you do not have, right, that is why you have your initial preparation days to make your material ready for the last 3 to 4 days of revision, where you write down your weak points, right, or your volatile points. If you have not done that, don't worry about it. All you need to do is quickly skim through your the notes, and if you have not done yet, just write down, like today is 8, then 9, 10 and 11. So the 4 days that you have, just write down ki kaun se subjects I'll be focusing in these 4 days. Focus subject wise ki let's say you have now 19 subjects and you have 4 days. So abhi tak nahi kiya to 5 subjects karke in a day. That is what should be your target. Okay, so you can combine like 2 big subjects or 3 big subjects and 2 short subjects in one day, and just focus on the most important points. And this is how you should plan. And no matter whether you are able to finish, not able to finish, just move on to the next set of subjects tomorrow and then day after. Because if you keep doing the subjects that you plan for day 1, you will never be able to go to the next set of subjects, right? So try to put things into your short-term memory. If you have your list, like from those 5 subjects which I'm planning for today, I have my list, like these are my volatile topics. I'll focus on that. If not, quickly go through the entire notes, right? And PYQs, like I said, just go through the question answer, all your FMG papers, and also the last NEET PG exam, at least if you have not done yet. Okay. Right. Thank you so much, everyone. NEET PG PYQs, at least, yeah, they are actually important for your FMG exam. There's a lot of overlap between FMG and NEET PG. Okay? Rahul asking what to do when you're not able to recall topics. First of all, just leave everything aside, stop studying and close your eyes and focus on your breath, right? As soon as, basically you start focusing on your breath, your heart rate also comes down and you get, a bit calmed down, and then you start try to recall that. Because when you are in that stress and panicky state, even a simple of a topic you will not be able to recall. Right? So that's what we are doing. We are trying to revise the most important topics here with the final punch sessions so that you get that confidence and you revise some mnemonics also before your exam. Okay? Yes. All right. So let's start with the today's session. And if you have still any queries, we will definitely discuss it towards the end of the session. Also, I've shared the PDF already on the Telegram group. So today's session has MCQ based discussion with the tricks that you are going to learn here. Okay, so let's start with the first question here. What is, I'll tell you some tricks, guys. When you get zoned out, when you're not able to recall, how do you logically guess the answers? All of this is definitely we should learn and we should apply it in the exam hall as well. INICT questions, if you have not done yet, skip it, right? Don't do it in the last day, because the questions will be a bit eccentric and that might unnecessarily lead to that loss of confidence. अगर पहले किया है तो रिवाइज करो, नहीं किया तो छोड़ दो INICT के क्वेश्चंस. Was it? MedSynapse is absolutely essential for your exam. But like I would honestly tell you that it's not sufficient, but yes, essential. Okay, you need to complement it with some other resource as well. Okay. NEET PG questions, at least last 2 years ke kar lo. Okay, that's going to be important. Chalo. All right. So let's start discussing the questions. What is the nerve supply of the muscle shown in the image here? Right? Now see, suppose you get this question in the exam. You have not seen this image. You're like, ये तो मैंने देखा ही नहीं, ये मैंने revise नहीं किया, अब मैं इसका क्या answer करूँ? If you start panicking like this in the exam, you will never be able to logically guess the answer. If you maintain your calm, then you will start basically thinking like, okay, so let me try to think over it. This is some muscle that I'm seeing here, and this is the muscle in the arm region that I'm seeing, right? So when you are seeing the muscle in the arm region, right, and also look at what muscle is it. This is what process of the scapula? This is the coracoid process, infraclavicular. This one here, this is the coracoid process going to the humerus. So what is this muscle going to be? From the coracoid to the humerus, the arm, the brachial part, this is going to be coracobrachialis. Okay, that is how you identify the muscle. You don't have to mug them up. You need to understand the facts, right? So this is coracobrachialis, muscle of the arm, the anterior compartment of the arm. You know, the nerve which comes here is musculocutaneous nerve. That's the nerve of the anterior compartment of the arm. Posterior compartment in the upper limb, the extensor compartment, that's the radial nerve, right? So it's not going to be radial nerve, it's the posterior compartment that you have here, right? So this is going to be musculocutaneous nerve. So musculocutaneous nerve supplies what other muscles? What is the trick to remember that? Remember, it supplies the muscles which are BBC. Okay, what is BBC? BBC is, one is coracobrachialis. What is the B and the B? It is biceps brachii and brachialis. Okay, so basically the brachial muscles जो आएंगे यहाँ पे anterior compartment में उसको supply कर रहा है. Which brachial वाला muscle it is not supplying? It does not supply brachioradialis. Always remember that, frequently asked, because brachioradialis is a muscle of the forearm and not the muscle of the arm. So brachioradialis is supplied by radial nerve, not the musculocutaneous nerve. It supplies BBC muscles, biceps deep to that brachialis, and then you have coracobrachialis, right? And this musculocutaneous nerve pierces the coracobrachialis muscle. Musculocutaneous nerve, it supplies brachialis, it does not supply brachioradialis, okay? And when I say it is musculocutaneous, so it has a cutaneous component also. That means somewhere it is supplying the sensation, the skin as well. So very, very important. This is one of your previous NEET PG exam question. It basically ends as this lateral cutaneous nerve of forearm. So when the musculocutaneous nerve is injured, there will be sensation loss along the lateral aspect of the forearm because the biceps is going, which causes elbow flexion, right? Biceps is the elbow flexion. So there will be loss of elbow flexion. There will be loss of sensation in the lateral aspect of the forearm. That is what you should remember. That's what has been asked in the exam. Okay, clear with everyone? Very, very important. And this musculocutaneous nerve comes from what cord of the brachial plexus? It is the lateral cord of the brachial plexus. Okay, it is the nerve coming from the lateral cord of the brachial plexus. Is this clear with everyone? Right? So this is how you approach these questions. We have discussed the topic of brachial plexus, right, with all the tricks and mnemonics in the MedSynapse app. Guys, we cannot go into the details of all the topics, right, due to time limitations. So please revise all these topics: brachial plexus, nerves of forearm, nerve injury in the hand, the nerves of the upper limb injury, wrist drop kisse hota hai, right? All that is very, very important. Okay? Hi, very good, Rashmi. Yeah, the Three Musketeers story. Going to next one, not a ball and socket joint. Joint is a very, very important topic in anatomy. Like last FMG, there was this question on joint, the joint between the epiphysis and diaphysis. Basically, जो growth plate वाला joint है bone में, वो कौन सा joint होता है? That's a synchondrosis, primary cartilaginous joint. Recent FMG exam question. Like then the question you have is, not a ball and socket joint. Absolutely. What is the mnemonic for this? This is the mnemonic for ball and socket joint. So you have talocalcaneonavicular, hip joint, shoulder joint, and I. TH And you have eye, but very, very important point to remember here, the eye is not incardomalleolar, it is incardostapedial. Remember in this, it is IS, it is incardostapedial joint, which is ball and socket joint, and not incardomallear joint. Malleus and incus के बीच का जो joint है in the ear, MI. If somebody gets MI, it's a sad event, right? It's a sad thing to get a MI. Remember, MI is sad, that means it is saddle joint. So you have the three ossicles in the ear, malleus, incus and stapes. This is going to be MI is sad, and this is ball and socket joint. So basically both of these are what kind of joints? These are synovial joints, right? These are synovial joints in the ear. So MI is sad and IS is going to be incardostapedial joint, is going to be ball and socket joint. Is this clear with everyone? So the answer here is incardomalleolar. Is this clear with everyone? Absolutely. Okay. Going to the next one. Which of these is not an action of inferior oblique muscle? Very, very important topic that's asked frequently. Recent NEET PG also had question on this. Not an action of inferior oblique muscle. What do you think is answer to this? Yes. Not an action of inferior oblique muscle. What is the answer to this? Nikhil, you are preparing for which exam? Is it FMG or NEET PG? Why many of you are answering B, guys? Dekho. At least what are the options that you will not mark as the answer at all? So this is one of the the cheat codes that you should learn. Like when you have this contradictory options, one action is saying depression, one is saying elevation. So Dr. Phoenix, understand that you will never mark the answer as A or C because you have contradictory options. या तो डिप्रेशन करेगा मसल या एलिवेशन करेगा, दोनों नहीं करेगा, right? So the answer has to be either B or either D. So automatically you ruled out option A and option C because you have contradictory options. One of them is right, one of them is wrong, right? So please do not mark A or C as the answer. Those are to be ruled out first, right? These are the small tricks that you learn, right? So now depression or elevation. So remember that for obliques, OBs, they do OPs, opposite action. If the muscle name is inferior oblique, it does the action which is opposite to inferior, that is superior. That means it does elevation. Okay, it does elevation rather than depression. So what does it not do? It does not do depression. So the answer here is going to be B. Is this clear with everyone? Is this clear with everyone कि B और D में जहाँ confusion था? So inferior oblique causes elevation and not depression. So remember, for oblique, the trick is oblique causes OP, that is opposite action, and oblique AB, oblique OB is AB. It causes abduction. Okay, it causes abduction. It causes elevation. And remember the other mnemonic, which is SYNRAD, that means superiors are intorters, inferiors are extorters. It causes extortion as well. RAD stands for recti are adductors. Okay, so obliques are abductors. Is this clear with everyone? So remember, obliques do opposite action. Similarly, if I ask you for superior oblique action, this was asked in INICT exam as well. Superior oblique के क्या-क्या actions होंगे? Oblique superior, opposite action करेगा, it will do depression, right? Intorsion or extortion, syn, superiors are intorsion, right? And it will do abduction, okay? And it will do abduction. Is this clear with everyone? Right. So that is about this question here. Going on to the next one, which is the life-saving muscle of vocal cords. Vocal cord का life-saving muscle कौन है? Lateral, posterior, transverse, thyroarytenoid. Which is the life-saving muscle of vocal cords? Very good. Absolutely right. So that's how you remember. Remember, who saves us from the kidnappers, the abductors? The trick to remember here is police saves us from the abductors. That is the kidnappers. So remember, police, PO is posterior cricoarytenoid, is what is the abductor. So which muscle is the abductor of the vocal cords? Remember, it is the posterior cricoarytenoid. Life-saving is something which is not closing the airway, which is opening the airway, abducting the airways. That's going to be posterior cricoarytenoid, the only abductor of the vocal cords. Pulley saves us from the abductor. Posterior cricoarytenoid is supplied by which nerve? All muscles of larynx are supplied by recurrent laryngeal nerve, except which muscle? Except cricothyroid, right? Cricothyroid, which is supplied by external laryngeal nerve, which is a branch of superior laryngeal nerve. And what is the action of this cricothyroid? Remember, cricothyroid CT is CT, it is a cord tensor. Okay, CT is CT, it is a cord tensor. Okay, so it's a cord tensor. Abductor is posterior cricoarytenoid. Is this clear with everyone? Right, so cricothyroid is external laryngeal nerve. Cricothyroid is external laryngeal nerve. Correct. Going to next one, and what is the safety muscle of the tongue? So safety muscle of tongue is something which is not allowing the tongue to fall back and close the airway. So something which is causing the protrusion of the tongue. Tongue protrusion. So bahar ki taraf jo leke ja raha hai, this is the genial wala, that is genioglossus. Okay, genioglossus pulls the tongue out. So that is the safety muscle of the tongue. All muscles of tongue are supplied by hypoglossal nerve, except which muscle? A muscle which is shared with the palate. Palate says this is my muscle, so my nerve will supply this muscle. Remember, palate के साथ share करने वाला कौन सा muscle है? Palatoglossus. Okay, remember, very, very important. It's going to be palatoglossus. Okay, that's palatoglossus. Is this clear with everyone? Okay, right? Yeah, the fan-shaped muscle that you see. Going to next one. Which of these is not an abductor of the hip joint? Which of these is not an abductor of the hip joint? Gluteus medius, minimus, maximus, or TFL? Yes, very good. The correct answer here is going to be gluteus maximus. Remember, maximus AX is EX. The major action here is the extensor. Max is X, that is extensor of the hip. Maximus is extensor of the hip, right? The rest of them, they do cause abduction of the hip. And what is the test that we do for this abductors? Your recent FMGE exam question as well. The Trendelenburg's is what you are doing. The Trendelenburg's test is what is done for the abductors of the hip, right? Look at this test here. This test basically tests the abduction of the hip. This is very, very important question. Every exam you'll find a question on this Trendelenburg's. Okay. So now if you look at this image, tell me that which side is abnormal. This is the right side. This is the left side. You're looking at the patient from behind. So which side is abnormal here? Right side or left side? Yes, very good, right? So on whatever side the patient is standing, stands, AN is abnormal side, right? And what drops is the OPS, the opposite side. Okay, the opposite side drops. Remember, stands on abnormal side and opposite side drops. You can see the patient is standing on the right leg. So this is going to be right side abnormal. So the right sided abductors are abnormal here, gluteus medius. And what is the nerve for that? It is superior gluteal nerve which supplies this gluteus medius and minimus. Maximus is सिर्फ नाम बड़ा है maximus, but उसका nerve छोटा है. That means it is inferior gluteal nerve and it is not inserting on the greater trochanter as well. Okay, is it clear with everyone? It's the right side which is abnormal here. Stands on abnormal, drops on opposite side. Okay, okay, is this clear with everyone? So this is Trendelenburg's, very, very important. Going to next one for Brown-Sequard syndrome, which is very frequently asked in your exam, which is hemitransection of the cord. The only thing which goes on the opposite side. Okay, remember, सब कुछ same side पे जाता है. Even the motor part, only the opposite side is pain and temperature. You remember it as opposite. OPT. Opposite side is pain and temperature, which is carried by OPT is SPT, that is spinothalamic tract. Okay, spinothalamic tract. Why spinothalamic tract? Because it is crossing at the spinal level. Okay, it crosses at the spinal level, so already the crossing has occurred, and that is why it is getting affected on the opposite side. So remember, opposite side OPT is opposite side pain and temperature carried by SPT, spinothalamic tract, which is crossing at the spinal level. Remember that dorsal columns, your corticospinal tract, the pyramidal tract, it's crossing at the medulla level. Okay, this is crossing at the spinal level. Okay, this is very, very important. OPT is SPT. Going to next one, corneal endothelium is derived from? Corneal endothelium is derived from neural crest, neuroectoderm, endoderm or surface ectoderm? Yes. What is going to be the answer to this? It's not surface ectoderm, right? You are talking about corneal endothelium. Endothelium अंदर की तरफ होता है, right? You have epithelium, stroma, and then the endothelium. Whatever is on the surface, okay? The epithelium is on the surface, that comes from surface ectoderm. Corneal endothelium comes from the neural crest. Okay. Now, similarly, if I ask you the question that the muscles, sphincter and dilator pupillae, okay, sphincter and dilator pupillae muscles, they come from where? This is very, very important question. Sphincter and dilator pupillae muscles, they are coming from? Yes. Remember the sphincter and the dilator pupillae muscles, these are the muscles of the iris. Okay, these are the muscles of the iris. These are iris muscles. What is the mnemonic for iris muscles is, remember, it is mine. The muscles of iris come from NE, that is neuroectoderm. This is very, very important question. They come from neuroectoderm, right? So this is the trick here, Devesh. I'm telling you all the tricks, right? All those who have been with me on Radsynapse app, you already know all the tricks. For others, remember, lens is legs. Okay, lens is legs. What does it stand for? That lens, epithelium, which is on the surface, and glands, they come from S, that is surface ectoderm. So lens, E for epithelium of the cornea conjunctiva, which are exposed to the environment. Extraocular muscles, muscles come from mesoderm, right? The extraocular muscles are mesoderm, paraaxial mesoderm. Iris muscles, remember mine, muscles of iris come from neuroectoderm. Retina, the retinal pigment epithelium, that also comes from neuroectoderm. Okay, it's like an extension from the brain. While the normal melanocytes, they come from your neural crest cell, but the retinal pigment epithelium is neuroectoderm. Epithelium of cornea conjunctiva exposed to the environment is surface ectoderm. Corneal stroma endothelium, remember it as crest. Crest, CR for cornea, endothelium and stroma. E for endothelium, ST for stroma, that is coming from crest. Is this clear with everyone? Is this clear with everyone, right? So remember that it is legs, that is lens is surface ectoderm. Okay, lens is surface ectoderm. Right, so remember that lens is very important, muscles of iris is important, that's asked very frequently, cornea epithelium, cornea endothelium. Even in the recent AIIMS exam, there was a question on retina pigment epithelium, so that's very, very important. Going to a favorite question in the recent years, you have seen it in the recent FMGE exam also. How do you identify the segments of the liver? Right, the segments of the liver, basically remember, if you start from the left side, first of all understand that the liver is divided into upper half and lower half by the portal bifurcation where it is occurring. You start from the left side, go to the right side and keep doubling from 2, 2, 4, 8. Okay, so 2, 4, 8 and then comes 7. 2, 4, 8, 7 और नीचे sequential number है 3, 4, 5, 6. Right, नीचे आता है. So if I show you like this, right, the four segments here, 2, 4, 8, 7, 3, 4, 5, 6. Right, 4A is above. Remember in 4, A and B. A is above and B is below. नीचे वाला 4A and 4B. Now, when you are given a CT image or an image like this, how do you identify it is upper section or lower section? If you are seeing the kidney, definitely you are at a lower level. मतलब हम liver के नीचे वाले side में आ गए हैं, तो ये हो जाएगा 3, 4, 5, 6. अगर आप kidney नहीं देख रहे हो, मतलब ये ऊपर वाला है, it is 2, 4, 8, 7. Right, and in the midline you have the middle hepatic vein, the Cantley's line in the center which goes through the middle hepatic vein, dividing the liver into the right side and the left side. The left lobe of the liver is again divided into medial and lateral by the falciform ligament. Okay, the falciform ligament divides it into medial and lateral. Is it clear with everyone? Right? So this is going to be basically how you identify the liver segments: 2, 4, 8, 7, 3, 4, 5, 6. Out of that, you can see that this is going to be anterior, this is going to be posterior, right anterior, right posterior. ठीक है? So अगर मैं ऐसे liver को ऐसे दिखाऊं और ये थोड़ा पीछे की तरफ it goes, so this one is going to be right posterior. 2, 4, 8, 7, 3, 4, 5, 6. So 6 and 7 are right posterior. 5 and 8 are right anterior. Okay, they are right anterior. Is this clear with everyone? Okay. Let's go to the next question here. So, few questions from biochemistry now. Menkes disease is due to deficiency of copper. Copper deficiency is Menkes, copper excess. Excess copper, copper deposition किसमें होता है? Wilson's disease में होता है. Wilson is what gene? ATP7B. Remember B for beta, Wilson is beta. Sun is beta, so that's ATP7B. Menkes is going to be ATP7A gene, okay? And what is the chromosome number for Wilson's? Chromosome number is chromosome 13. I hope you remember 13 wala story. At the age of 13, Wilson pataus Barkha with 2 eyes. So Wilson pataus Barkha 2 and eyes wala retinoblastoma. So retinoblastoma RB gene is also chromosome 13 Q14, right? So that's on chromosome 13. Okay, and Menkes is copper. What is the enzyme which is deficient here? What enzyme is deficient here? Which is this copper dependent enzyme which is deficient here? Yes? Very good. That is lysyl oxidase. Okay, remember it is lysyl oxidase which is deficient here. Remember, Y containing enzymes are copper containing. Lysyl oxidase is what is deficient. Again, one of the recent exam questions, NEET PG exam question. Okay. Going to next one, melanin is derived from which amino acid? Melanin is derived from which amino acid? अगर melanin नहीं होता है तो क्या होता है? Albinism. Albinism में कौन सा वाला deficient होता है? Enzyme tyrosinase. So you know that it is tyrosine. How do you remember this? Tyrosine is tire. What is the color of the tire? Black color. Black tire. Okay, tyrosine gives the black color, that is melanin. Black color का tire. और क्या थी हमारा story में? Yes, the Radsynapse students here. What is the other part of the story? Black color tire. किसका tire है ये? Cab का. उसमें से क्या आ रहे हैं? Fumes. Fumes coming out from the black tire of the cab. So remember that cab is cabbage odor that is seen in tyrosinemia type 1. Fumes is tyrosine is what forms fumarate, and that is how it is linked to your TCA cycle as well. Right? So cabbage odor tyrosinemia, and fumes is it forms fumarate. Okay, right. So quickly revising the amino acid products which are very, very important. Do not confuse melanin and melatonin. Melatonin, serotonin, toto comes from trypto. Right? Remember, toto comes from trypto. So melatonin, serotonin is tryptophan, while melanin black is tire, that is tyrosine. Okay, that is tyrosine. Okay. विटामिन B3 कल देखा था विटामिन B3 पैलेग्रा कैसल्स नेकलेस कहाँ से आता है? इवन दैट इज फॉर्म्ड फ्रॉम ट्रिप्टोफैन. सो रिमेंबर इट एज ट्रिप्टोफैन इज ट्राई. इट फॉर्म्स विटामिन B3. B3 is formed from tryptophan. 60 milligram tryptophan forms 1 milligram of niacin. Okay, right? And T3, T4 catecholamines, thyroid hormones जब बढ़ जाते हैं, it's like a state of excess catecholamines जैसा. Remember all this, thyroxine rhyming with tyrosine. It is coming from tyrosine, right? Thyroxine is coming from tyrosine. So remember, it is T3, T4 and catecholamines. Both of these are also coming from tyrosine. So catecholamines में basically क्या आता है? Dopamine भी आता है, norepinephrine, epinephrine, all of this is coming from tyrosine. Is this clear with everyone? Right? Going to the next question, Western blot is done for. What is Western blot done for? Remember it as snow drop. Okay, remember snow drop. Southern blot DNA, northern blot RNA, Western blot is done for proteins. Okay, Western blot is done for proteins, right? So will I do the Western blot for antibodies? Yes, because antibodies are basically proteins, right? Immunoglobulin wale jo hai, gamma globulin, these are proteins. So for antibodies like ANA antibodies देखना SLE के patient में, so we will do Western blot. Okay, clear with everyone? Yes. Okay, so Western blot is done for proteins, very, very important. Southern is for DNA, northern is for RNA. Going to next one, vitamin K is required for hydroxylation, carboxylation, chelation, transamination. What is it required for? Vitamin K is required for yes. Just a minute, I'm doing a live chat. Absolutely right. Remember, K is for K, that is carboxylation. Vitamin K is required for carboxylation, right? And carboxylation, kaun sa carboxylation? Remember G and G. Gamma carboxylation of glutamic acid residues on the clotting factors, which are 2, 7, 9, 10. Okay, these are vitamin K dependent clotting factors 2, 7, 9, 10. So remember, it's required for carboxylation. For hydroxylation, hydroxy water C. C is filled with water. So remember, vitamin C, that is proline and lysine hydroxylation in collagen, right? C for collagen, okay, K for carboxylation, and C is for hydroxylation. For transamination, we require which vitamin? Vitamin B6, pyridoxal phosphate. Right? So remember, pyridoxine wala, that is required for transamination. Is this clear with everyone? Okay. Please do not forget to revise biochemistry from Sureshot. Majority of your questions in biochemistry will be covered in the Sureshot biochemistry class that we have had in Radsynapse app. All your vitamins topics, the inborn errors of metabolism, that is your glycogen storage disorders, sphingolipidosis, right, and fructose wala, galactose wala, all those is where you get questions in biochemistry. Amino acid disorders ho gaye, alkaptonuria, phenylketonuria, theek hai, they are very, very important. Please revise it. Okay. Next one, Km increases, Vmax remains same. This is what inhibition, guys? Km is increasing. Okay, KMII. This is going to be, you write it as competitive inhibition. In competitive, remember it is KMII. Km is increasing in competitive inhibition. Km is increasing in competitive inhibition. There the Vmax remains the same. Right? When you look at Lineweaver-Burke plot, what kind of graph do you get with Lineweaver-Burke plot? The double reciprocal जो plot होता है उसमें कैसे मिलती है lines? Crossing होती है, V shape होता है, parallel होती है, कैसे होती है? Remember, competitive, C for crossing. Competitive gives the crossing lines. If you see lines are crossing, it is competitive. Okay, crossing lines in competitive, is that what you see? Right. Very good. What happens in non-competitive? No Km increasing. Rather, it is Vmax decreasing. In non-competitive, it is the Vmax decreasing in non-competitive. Okay. All right. Going to the next one. Malonate inhibits which enzyme, right? Our favorite mnemonic here, malonate, MSD. MS Dhoni. Malonate inhibits SG. That is succinate dehydrogenase, succinate thiokinase. Nahin, do not directly jump to the answer. Succinate mujhe pata hai, so I'll mark B as the answer. Do not do this silly mistake in the exam. Look at the options very carefully. Okay, so remember it is succinate dehydrogenase. Okay, so MSD, MS Dhoni, malonate inhibits succinate dehydrogenase. This is an example of competitive or non-competitive inhibition. How's MS Dhoni? MS Dhoni is a competitive personality, right? Wants to win the match. And how is he? He's strong like an Iron Man. So what do you need for succinate dehydrogenase? You need iron. Okay. And this is basically what complex of the ETC? ETC, what complex is it? ETC complex 2. Remember, malonate, succinate is 2. TT wala ending in T. Remember, it is ETC complex 2. Succinate dehydrogenase wala. Okay. Right. So, this is done here. Going to the next question. ETC inhibitors, very, very important in biochemistry. What do you see here? Phenobarbital, rotenone, that is barbiturates, is complex 1. Ending in 1 is 1. Malonate is 2. Cyanide, carbon monoxide, azide, hydrogen sulfide, ending in IDE, IDE, D is 4. But remember, it does not include carbon dioxide. It does not include nitrous oxide. ठीक है? इसमें ये वाले नहीं आते हैं. As the inhibitors, you have carbon monoxide, you have cyanide, azide and hydrogen sulfide. Okay, the complex 4 is what is cytochrome C oxidase. Okay, it is cytochrome oxidase. Oligomycin, oligo matlab decreasing. Oligo is decreasing the going of the protons. Basically, it affects the proton gradient in the complex 5. Okay, complex 5 of ETC. It decreases the proton gradient. Oligo decreases the proton gradient. Absolutely right. Going to next one. What is the cofactor for xanthine oxidase, guys? What is the answer for this? Remember, for XO xanthine oxidase, it is MO. That means it is molybdenum. For XO, it is MO. Xanthine oxidase is what is required for synthesis of. कहाँ पढ़ते हो? यूरिक एसिड वाले में पढ़ते हो, गाउट में पढ़ते हो. Xanthine oxidase is inhibited by what drug? You have allopurinol, right? And similarly, you have febuxostat. The term itself tells you febuxo is xanthine oxidase and static, making it static. So, static inhibiting xanthine oxidase is febuxostat and you have allopurinol. So, this is basically XO is MO. Okay, XO is MO. Selenium वाला क्या था? Selena Gomes के क्या थे? Perfect thighs. Perfect thigh of Selena Gomes. Okay, perfect, beautiful thighs. So remember, thigh is thio wale enzymes. Okay, so glutathione peroxidase. Remember, perfect is peroxidase. So glutathione peroxidase is going to be selenium. Okay, that's going to be selenium. Zinc is rhyming with carbonic. Zinc is carbonic anhydrase. Carbonic anhydrase is zinc. Okay, clear with everyone? Yes, perfect thighs is what you should remember. Okay, so remember, perfect to remember, it is peroxidase, glutathione peroxidase. Okay, going to next one. What do you think will be answer to this one? Blood glucose levels cannot be augmented by mobilization of muscle glycogen due to lack of which enzyme? Which is the enzyme which is not present in muscle? And that is why you do not get directly glucose from there. It has to go to the liver and then it forms the glucose. Very good. That's B. That is, that's basically your glucose 6 phosphatase. The last wala step है ना, वहाँ पे आके वो basically अटक जाता है. You know the learning lesson here, if you have all the enzymes in the cycle, but if you do not have the last enzyme there, you will not get the final product. So similarly, if you have done all the steps of your preparation before, right, in your last 6 months, 1 year, but in these last few days, if you fail to catalyze your reaction, right, that enzyme is absent, which is helping you catalyze your reaction, right? Remember, ये final जो इतनी पूरी मेहनत है वो fail हो जाएगी, right? So that's the learning lesson here. Even the last enzyme is important, that is glucose 6 phosphatase, to get the desired product, to get the desired result and the desired score. Okay, so remember glucose 6 phosphatase या absent है, इसकी deficiency से क्या होता है? कौन सी disease होती है जब glucose 6 phosphatase नहीं होता है? Yes. Remember the last one, it is von Gerkees. Okay, von Gerkees is due to deficiency of this glucose 6 phosphatase. Von Gerkees is what? How do you remember von Gerkees? Von Gerkees is a disease where everything else has one except for glucose. यहाँ पे severe hypoglycemia होता है, right? There is severe hypoglycemia, but rest everything has one, it has increased. There is increased uric acid, increased ketones, increased lipids, right? Rest everything is increased except for glucose. Everything one except glucose. Absolutely right. Okay? Remember, glucose 6 phosphatase नहीं है. Similarly, दूसरा क्वेश्चन एंजाइम डेफिशिएंट पे याद रखना, नीट पीजी में जो आया है, लिवर कैन नॉट यूटिलाइज कीटोन बॉडीज because of deficiency of what enzyme? Remember, it is thiophorase. Okay, because of the deficiency of thiophorase, liver cannot utilize ketone bodies. Okay, yes. Going to the next one, glucose can be synthesized from all except. What do you think will be answer to this one? Glucose can be synthesized from all except. Very good. Acetyl-CoA is not a substrate for glucose formation, right? And if I give you the other option, odd chain fatty acid, even chain fatty acid, which is a substrate for gluconeogenesis, that is forming the glucose. Remember, odd chain fatty acids, they can form glucose because they give propionyl-CoA. Even chain amino acids, they give acetyl-CoA, so they do not form glucose, but odd chain fatty acids can form glucose. Okay, very, very important. So this gluconeogenesis. Gluconeogenesis takes place where? In the mitochondria or in the cytoplasm? In the mitochondria or in the cytoplasm? Remember, hug wali cycles, you hug with both the arms. So the hug occurs in both, that is cytoplasm and mitochondria. Remember, it is both. Heme synthesis, urea cycle, gluconeogenesis, that occurs in both. Remember, H for heme, H is not for HMP. HMP occurs in cytoplasm, so it occurs in RBCs also. Okay, very, very important. Going to next one, myocardium normally utilizes. Myocardium normally utilizes which of the following? Yes. Very good. Absolutely right. Remember, it is fatty acids. Heart normally uses fatty acids and not glucose. Again, we have discussed this in Sureshot, right? So, myocardium normally utilizes fatty acids, very, very important, and not glucose, right? RBCs are something which are dependent only on glucose. They cannot use anything else because they do not have any organelles, right? So, they are solely dependent on glycolysis, plus they have HMP shunt, which helps in their free radical scavenger. Okay, okay. So remember, myocardium normally is what we are talking about. Normally they utilize, my heart uses fatty acids and not glucose. Okay, very, very important to remember. Going to next one, what is the apoprotein for chylomicron remnant? Saurabh, do not worry, right? Let's not be so selfish. And anyways, we are not giving out like the entire content out here. You're feeling that we have subscribed to the app or सब कुछ YouTube पे हो रहा है, ऐसा नहीं है, right? These are just some snippets and the most important points that we are discussing. Of course, you have so much of treasure with your Sureshot and Extra Edge and MCQ discussion videos in the app, right? Apoprotein for chylomicron remnant is, remember, remnant is E. It is apoprotein E. A1, okay, it is apoprotein E. Okay, so remember that this is your apoproteins here for chylomicron. सिर्फ पूछा chylomicron, जो chyle मतलब intestine वाले से आ रहा है, dietary वाले food से आ रहा है. Remember that is ApoB48. LDL has lone apoprotein which is ApoB100. Chylomicron remnant is apoprotein E, and HDL, H for healthy wala. Okay, this is a healthy cholesterol, HDL, which is a good one. We should have high levels of HDL, low levels of LDL. Okay, HDL healthy, high. LDL lethal, low. Okay, so LDL levels should be low, HDL levels should be high. So HDL is A1 quality ka lipid, right? A good quality lipid, and that is why it is going to be it is A1. Apo A1 is going to be for HDL. Apo A1 is going to be for HDL. Is this clear with everyone? Okay. So remember the most important, and ApoB48, ApoB100, remember they are coming from the same primary RNA product, but the difference is because of RNA editing. Okay. All right, going to the next one. Very favorite topic for the question, tumor lysis syndrome. Which of the following is not seen in tumor lysis syndrome? What is the answer for this one? Not seen in tumor lysis syndrome. Very good. It is C. You do not see hypercalcemia, you see hypocalcemia. Okay, so look at this. Tumor lysis syndrome is seen with high-grade tumors. Basically, when there is the tumor, the cells are getting lysed, the changes that are happening, the cell lysis releases the potassium. Potassium is present inside the cell. So it is coming out. There's going to be hyperkalemia. There's going to be hypocalcemia, hyperuricemia, hyperphosphatemia. Everything is hyper except your hypocalcemia. There's hypocalcemia that you see here and not hypercalcemia. Important to remember this. Okay, very important. Going to next one, your recent FMG exam question as well. We have discussed all the pedigree inheritance tricks in the Sureshot. We have discussed the story mnemonics for autosomal dominant, autosomal recessive again in Sureshot classes. Tell me, what inheritance does this pedigree chart show? What is the pattern of inheritance that you are seeing here? See, whenever you have mitochondrial in the option, always rule out that first, because that's the easy one to be ruled out, right? The mother is giving the disease to all, the mother is giving the disease to all, the father is giving to none, right? Mother to all, father to none, mother, maternal is mitochondrial, right? So everything, this is coming from the maternal side. Mitochondrial DNA is coming from the mother. Mitochondria has DNA apart from nucleus in the cells, right? It comes from the mother. So mother gives the mitochondrial DNA to all the kids. So remember, mother is transmitting to all and father to none. This is going to be mitochondrial. Okay, this is going to be mitochondrial. Okay, बस अभी थोड़ा ही और है, बहुत ज्यादा नहीं है. ठीक है, चलो next one. What is the CD marker positive in this case? What is the disease that you are seeing here? CD marker positive in this case is going to be what CD marker? This is the tennis racket appearance of the granules here. What is this called as? This is called as Burbick granules. Burbick granules, which is seen with LCH, Langerhans cell histiocytosis. Remember, L is like number 1. Okay, L is like 1. This is going to be CD1A. CD1A, CD207, right? That is what it is positive. It is S100 positive, right? LCH S100 positive, CD207, CD1A. Okay, so remember this is very important image. CD103 कल हमने देखा था. 103 is hairy cell leukemia. CD19 is a pan B cell marker. 3 is T. T for 3, it's a pan T cell marker. This is going to be CD1A positive. Right? And what is generally the history given in LCH? The history given in a LCH, generally it's a child. There are lytic lesions in the skull that are present. There can be diabetes insipidus as well. There can be exophthalmos which can be present, right? So, you have that spectrum in LCH, Hand-Schüller-Christian disease. Okay? All right. Going to the next one. This is seen with which congenital infection? What are you seeing here? What are you seeing here? Which congenital infection? So basically we are seeing here cataract. And what do you see cataract with? Congenital rubella. Okay. So congenital rubella, very, very important. Remember, it has cataract. It has SNHL. All your congenital infections, they have SNHL. Not conductive hearing loss, but SNHL. And what else will you see here? Very, very important question in the heart. What does it have? In the heart, what does it have? Patent ductus arteriosus. It is patent ductus arteriosus. Very, very important. Congenital rubella is patent ductus arteriosus. Blueberry muffin rash also is what do you get, right? And patent ductus arteriosus is what you see with congenital rubella. Now, since we are at ductus arteriosus, few important points here. Ductus arteriosus is derived from which aortic arch? Remember, ductus is D, right? D is the inversion of what number? This is number 6. So, remember, it is left 6th arch. It is left 6th aortic arch, ductus arteriosus. What drug would keeps it open and what closes the ductus arteriosus? Remember to keep it open, okay, it is PE, that is prostaglandin E1, alprostadil. Opposite to close it, you have NSAIDs. Okay, opposite of prostaglandin is NSAID. So, indomethacin, ibuprofen will close it, and that is why you should not give it, the NSAID should not be given in the late third trimester. It will lead to early closure of the ductus arteriosus, right? And to keep it open, you have prostaglandin E1, alprostadil. Okay, and one of your recent FMGE exam question, ductus arteriosus which is present here. Ductus arteriosus is the duct connecting two arteries, that is pulmonary artery and the aorta. So, which nerve is at a risk of injury when you are operating near ductus arteriosus? So, कौन सी nerve जाती है? Because of this ductus arteriosus on the left side, remember you have this left recurrent laryngeal nerve which arches, which recurs, which curves around the arch of aorta, right? So, remember it is the left recurrent laryngeal nerve. Left one is the longer nerve because of the persistence of this left 6th arch giving rise to ductus arteriosus. Okay, so you have this left recurrent laryngeal nerve which is present in this aortopulmonary window. So, whenever there is a surgery here in aortopulmonary window, ductus ke paas, there is a risk of the injury to this left recurrent laryngeal nerve, left side. That's also you should remember. The right recurrent laryngeal nerve recurs, curves where? ये जो सबक्लेवियन आर्टरी होती है गोइंग टू द लिम्ब, इसके अराउंड कर्व करती है राइट रिकरेंट लैरिंजियल नर्व. ओके, जो लेफ्ट वाली है वो आर्च ऑफ एओर्टा के वहां पे कर्व करती है. ओके, क्लियर विथ एवरीवन? सो लेफ्ट वाली इज लॉन्गर, right wali is shorter. So, left is at more risk of injury. Okay, is it clear with everyone? Going to next one. Which parasite lives in the bladder? Bladder में कौन सा होता है? Schistosoma. और schistosoma से भी कौन सा होता है? It is schistosoma hematobium. Remember hematobium, BU, bladder, urinary bladder में रहने वाला है hematobium. Schistosoma hematobium. It can cause cancer, malignancy of the bladder. Which malignancy of the bladder? Transitional cell carcinoma, squamous cell carcinoma. What cancer does it cause of the bladder? Transitional cell or squamous cell? Remember, schistosoma SC causes SCC, squamous cell carcinoma, squamous. Okay, it is SCC is what it causes. So identify the egg here. What egg are you seeing here? Look at the egg. Parasitology में eggs बहुत important है. Microbiology again, your short microbiology covers major important topics with all the tricks, guys. Right? Biochemistry, microbiology, pharmacology. ये subjects you should have thorough revision of the short. Okay? Available in the Radsynapse app. Okay, very good. This is going to be ankylostoma. How do you identify it? What's the trick? In this egg, you can see this clear space, right? There is this clear space which is present. So when you want to clear the space in the room, what do you use? You use hooks and nails. Okay, remember hooks use karte hain, nails use karte hain to, organize the things, to keep the things organized. So hookworm, which is ankylostoma, has a clear space. Okay, this is the clear space present in hookworm, that is ankylostoma. What deficiency does it lead to, hookworm? GI bleed karke hookworm causes iron deficiency anemia. Okay, hookworm causes iron deficiency anemia by causing the GI bleed. All right, and which parasite causes B12 deficiency? B12 2 wala is Diphyllobothrium latum, that causes B12 deficiency. Okay, that causes B12 deficiency. Okay, clear with everyone? FMGE aspirant, see, if you are not able to revise your primary resource, like I mentioned, subjects like microbiology, pharmacology, biochemistry, if you want to, quickly revise these subjects with all the tricks, you can still watch the short videos. Do not watch anything else. Just at least watch the short videos. बहुत सारे tricks जो मैं जैसे आपको बता रही हूँ, you would learn there, right? They are just like maybe 2 to 3 hours में your micro, pharmac, biochemistry is covered, like 3 hours sessions, and you will cover, like in a day you can complete all your most important subjects there. Right? So do not, if you're planning to do it today itself, or zyada late mat karna, right? If you want to revise these subjects, right, and learn all the tricks. What is the drug of choice for this? A blank PDF Janvi already has been shared on the Telegram group. What is the drug of choice? सबसे पहले मुझे बताओ कि ये egg किसका egg है? What egg is this? Right, you can see a lateral spine. Okay, you can see a lateral spine here, not a terminal spine. So first of all, look at the schistosoma ke eggs which have spines and knobs. So when you have terminal spine, remember T for hematobium has a terminal spine. Very, very important. Hematobium is terminal spine. Manzoni also has a spine, but a lateral spine. And Japonicum, when you write Japonicum, write it as Japonicum to remember it has a knob. Okay, Japonicum has a knob. While these have the spine, hematobium has terminal spine. This is schistosoma manzoni. For all the cystodes, trematodes, the drug of choice is praziquantel. For all the cystodes and trematodes, the drug of choice is praziquantel, except for, this was asked in INICT as well. Remember, for NCC, neurocysticercosis, for hydatid cyst caused by echinococcus. Okay, what do we use? We use albendazole. For trematode में जो fluke है, liver fluke है, fasciola hepatica. Okay, the liver fluke. What do we use? This was the question asked, recent exam, drug of choice. Fasciola hepatica is triclabendazole. Okay, remember it is triclabendazole for fasciola hepatica. You can remember it as tricolor flag of fasciola. Flag is fasciola. Tricolor triclabendazole is for fasciola hepatica. Okay, fasciola hepatica is triclabendazole. Okay. Clear with everyone? Going on to the next one. So this we have seen is hookworm. This is schistosoma. Very, very important. What egg is this? Barrel-shaped bipolar mucus plug. This is going to be Trichuris trichura. Okay, tritura, where you have seen there's going to be history of rectal prolapse present. It is also called as whipworm, right? So tritura. And the egg which looks a scary egg like this, scary egg is seen with ascaris. Ascaris, a scary egg, right? जो मोटा है और एक ये पतला है. Long and slim is unfertilized female. Fertilized female is moti female. So round moti is fertilized. Long and slim is unfertilized. But remember that which of these floats in the saturated salt solution? Floats is fertilized. FF, fertilized floats. So do not underestimate a fertilized, a pregnant female, right? Thinking that moti hai to sink ho jayegi, aisa nahi hai. It will float. So fertilized floats important. F for F, fertilized floats. Going to next one, and I believe this is the last question for today. Capgras syndrome is, what is Capgras syndrome? Yes? Option A, option B, option C, option D. What is Capgras syndrome? Is it A or is it B? You know that it's something related to misidentification. Yeah, so do not get confused. Very good. Majority of you have answered it correctly. It is B. Remember, Capgras is CPRS. Common person, that is a known familiar person, is replaced by stranger, right? So like the wife is replaced by nurse. So familiar person, common person is replaced by imposter, that is stranger. That is what is Capgras. Okay, that is what is Capgras. And the other one, Fregoli is only, that is only one person coming in fray, that is different role. Different role, only one person is taking different forms basically to kill that person, right? कोई साजिश कर रहे हैं उसको मारने के लिए, तो एक ही बंदा अलग अलग फॉर्म ले रहा है. That is what is Fregoli. Wife cheating another man. Okay, so when the man will come to know about that, his response will be, oh teri, I trusted my wife और उसने मुझे cheat किया. So oh teri is Othello syndrome, infidelity वाला. Famous person is in love with the patient. This is what Clara feels. Clara is the personal, the PA to the boss, who feels that boss loves her. So remember, this is Clara feels like this. That is D. Clarenbold. D. Clarenbold is where you have erotomania. Okay. So the person loves this person. Famous person is in love with patient. That is erotomania wala, love wala. That is D. Clarenbold. Okay. D. Clarenbold. Clara feels like that. Right. So yes. This is about today's session, guys, where we have tried to revise a lot of tricks and mnemonics along with the MCQs. Right? Trust me, all the tricks and mnemonics that you have learned, they will help you in your exam, especially if you have been with me since long on the Radsynapse app. All the tricks, for all the topics we have learned, all the tricks, just keep revising them. Okay, they will help you in the effortless recall in the exam. And these 4 days, like I said, plan out like five subjects, what I'm going to do, and stick to those 5 subjects for the day. Okay, so keep putting in your best till the last day. Like I said, remember, agar last enzyme bhi nahi hai, like that glucose 6 phosphatase in the muscle, your entire efforts, the entire cycle will go in vain. Okay, so annotated PDF, again, I would be sharing in the Telegram group. Creating happiness, again, we have discussed all of that in the Sureshot, and the Sureshot extra is in the app. With the time constraint, of course, I cannot discuss everything in detail here. Right? All right. Thank you so much, everyone. JackStat wale, Rashmi, this is your query from the live session itself, right? Growth hormone wala is JackStat. But insulin is not exactly JackStat. Okay. Try using a Synapse code. You can try using that, FMGE aspirant. Okay. And if you have still any queries, you can reach out to the support team. The number is 9922882189. Right? For any queries, you can reach out on this customer support number. Okay. All right. Thank you so much, everyone. So this was Sureshot session 2, FMG final punch. We will have Sureshot session 3, and that is going to be again tomorrow at 12:30 noon. That is going to be part 3. Then we will have part 4, and you'll get all the details, guys, on the Radsynapse app. Like just download the app, and you'll get all the details there. If you, like I said, if you still have any queries, you can reach out on this number. I'll share this PDF on the group. Sure, ECGs we will do tomorrow. Okay, we'll do a quick revision of all the important ECGs that are asked in your exam tomorrow, with all the tricks on how to identify the ECGs and a few pharmacology tricks as well. And if there's anything else, do let me know that as well. We'll try to cover that tomorrow and day after. Okay. All right. Thank you so much, everyone. Have a great day and keep studying, keep revising, keep synapsing, and keep winning. Thank you.